tinnitus, or ringing in the ear, is a very rare symptom of adrenal fatigue syndrome. This is Dr. Lam, founder of drlam.com. Now, very few people have this symptom, but some do. And these people usually have no other type of adrenal fatigue symptoms. In other words, their presentation of adrenal fatigue is not necessarily massive fatigue or lethargy. There may be some. They may be under a lot of stress, but their clinical presentation is more of ringing in the ears for no apparent reason. Now, we don't know the exact cause of this. Usually, numerous doctors have been solicited, extensive workup have been done, and the ear, nose, and throat doctors have been consulted, and CT scans of the head has been done, as well as many medications has been tried. But usually, it does not get better. The tinnitus appears to be non-positionally related. And it comes on, and sometimes the ringing gets louder as the day goes by, but not necessarily so. It is rather ambiguous and not very clear-cut. It's one of these things that the sufferers may complain is usually not debilitating, but it can kind of progress and become very annoying because numerous workups are usually very negative. Well, how do you know that this is tied into adrenal fatigue? Well, the answer is you don't, 100%. What you do think of, and what we as clinicians think about, is to put this together as one of those very rare symptoms, but it does present. When it's present, as I said earlier, it's kind of a stand-alone thing, although sometimes it can be associated with other symptoms as well. But more often than not, a person will come in stressed out, and their complaint mostly would be ringing in the ears. Now, there may be other complaints as well, as I said earlier, but those are not prominent. So when you have this type of situation, you have to take a detailed history, figure out what is really going on. We think that sometimes it may have to do with a neurotransmitter called norepinephrine that's released from the brain, and that may have some pathways that we have yet to know on how to trigger this ringing situation. Suffice to say that if your body has all been totally examined and everything is normal, then what you can do is to think about adrenal fatigue. Now, interestingly, normally this can go away when the adrenal support is given and the body's adrenal system seems to improve. We see that quite frequently. So in that sense, it is a somewhat benign symptom unless it is very advanced, and in which case it can actually be quite debilitating. There's been some use over the years of certain types of nutritionals that can be beneficial in this respect, but a lot of trial error and errors is involved, and there's no definitive way to say that it is exactly what it is and the reason. But it's an alert. It's something that you want to think about if there's nothing else going on and it seems to bother you and you have adrenal symptoms at the same time. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I've written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.